Hello, my name is Mary Cloud. I'm the Assistant Director for Riverbridge Regional Center. Our interview today is with one of our mental health therapists. With us, we have Janet Earley, and she is here to tell you about the mental health services she provides children and families that come to Riverbridge. Janet, would you please introduce yourself, your time at RBRC, and your background?
Sure. Well, Mary, thanks for doing these interviews. I have been at Riverbridge for over a year. I started in 2019, and my position at Riverbridge is to connect families that come to Riverbridge for services to mental health support. I'm a licensed clinical social worker. I have a master's degree from Colorado State University, and I've lived in the Roaring Fork Valley for a long time. I've worked with children and families for over 30 years in various different positions.
Wonderful. Well, we're very happy to have you on our team. Riverbridge is a nationally accredited child advocacy center. Therefore, our therapists use only evidence-based therapies while working with child victims of abuse and their non-offending family members. Janet, can you share and explain what some of these specialized therapy practices are?
Sure, I'd be happy to do that. Similar to a medical doctor, the therapists at Riverbridge and the therapists we refer children to and families to are providing interventions that have been rigorously tested to be effective. We call these evidence-based therapies. Just like when a doctor prescribes a medicine for you for an infection, it's been tested by scientists to make sure that it'll get rid of the infection, and you have to take it as prescribed at the right time and finish the whole dose. The three therapies that the Child Advocacy Accreditation Agency recognizes as being evidence-based are trauma-focused cognitive behavioral therapy, TFCBT for short, eye movement reprocessing and desensitization, EMDR for short, and parent-child interaction therapy, PCIT. Each of these therapies has a step-by-step process that therapists follow to make sure that the child or parent receives the exact same treatment as the scientific experiments proved were effective, just like when you take the antibiotic for an infection. I do need to mention that not everyone needs to have therapy after they've had an upsetting experience. Some people are able to recover from traumatic events without doing therapy. The way we're able to determine if therapy is needed is by using a screening questionnaire that the child or parent completes. If the results indicate that a child may be experiencing post-traumatic stress, depression, or anxiety, we recommend that he or she attend therapy. So, therapy is not forever. Therapy is only effective needed when a child or the parent are experiencing distress. So it's time limited and it is results oriented.
Wonderful. Now, recently, Riverbridge was honored with the Two Rivers Community Foundation grant to assist you in delivering Parent-Child Interactive Therapy, or PCIT. Can you tell us some more about that type of therapy?
Sure. So PCIT is a therapy that involves both the child and the parent together. The therapist uses direct parent coaching through an earbud. The therapist is not in the room with the child. They're in a separate room, and they're coaching the parent through an earbud. And the parent and the child play together, and then the therapist provides direct coaching to the parent. And the reason this helps is it helps the parent learn and use effective parenting skills. Sometimes after children and parents have experienced a traumatic event, the child's behavior becomes oppositional, and that's different from not listening. Oppositional means that the child refuses to comply with any adult requests, either their parents or teachers, any adult. So this presents a lot of challenges for the child, the family, and the school. So PCIT helps the child and parent learn to cooperate and respect each other. That, in turn, helps with other adult relationships the child has, like with their teacher or grandparents. And there's a specific age range that it has been found to be effective with, and that's 2 to 8 years old. So it's a pretty specific therapy.
Okay, thank you for explaining those types of therapies that we provide. Now, you mentioned that not all children or families need to come to therapy. But what benefits does therapy provide children and families?
Well, for children or parents that are experiencing distress after a traumatic event, flashbacks, nightmares, significant changes in behavior, loss of interest in things that they used to be interested in doing. The mental health therapies that we offer help teach parents and children coping skills so that they can kind of deal with those upsetting emotions that they're having, manage them, and then if they're having intrusive thoughts or memories, help process those memories in a way so that they become less distressful.
Well, thank you so much for explaining that. Now, I've recently read the book Spilled Milk, which was based on a true story about a girl's experience and history with abuse. Now, in it, she talks with her therapist and asks her why she chose to work with children of abuse and if she's had any history. Now, have clients ever asked you about your history or why you chose therapy work with victims of abuse?
Of course, yeah. People are always interested in why I've chosen to work with children and then specifically children who've experienced traumatic events. I've never had a child ask me directly if I've experienced something traumatic. If they did, I would explain that over half of children experience abuse or neglect, and that wouldn't be unheard of for me to have had something scary or upsetting happen. The most common question I get is from parents, and that is, do you have kids? So I have a lot of experience, but I know it's nothing like being a parent. And so I just try and, acknowledge that that's a different experience than being a therapist, and their experience is absolutely valid.
Now, having children open up to you and share their traumatic experience can be often difficult and very hard. What do you do to take care of yourself?
So I make sure I come to work ready to listen and to be available for the families that come in. The most important thing I do to be able to do that is to get outside every day. I love all the seasons in the mountains, maybe except a mud season. And I bike, hike, snowshoe, ski, and swim. And I'm learning how to use a stand-up paddleboard, which is very amusing. I get to laugh at myself.
Well, it's wonderful that you're keeping yourself active in your position in order to take care of our children and families on a daily basis. Now, thank you, Janet, for your time. Do you have any last words that you would like to share with our community?
Just that the reason Riverbridge is as effective as we are and we're able to help as many children as we can is because there's so many caring adults in our community that make sure that kids are safe, and we depend on them to make sure that if they do see anything concerning, that they call the Department of Human Services, the child reporting hotline. They can always call us if they have any questions, but we really encourage people to, if they're worried about something, to report it.
Wonderful said. Well, thank you so much for your time and your knowledge and your experience to share with our community. Thank you, friends and supporters, today for taking the time to meet with our Riverbridge team and understand the services we provide to our community. If you have any questions, please feel free to contact us at info@riverbridgerc.org. Have a good day.
Thanks, Mary.